all. Thank you for joining us today. We are doing a Medicare overview with the Center for Healthcare Rights. We have our friend Robert here, who's going to be the presenter today. And we're just going to be talking about navigating through Medicare, the A, B, C's, and D's of Medicare.
Thank you. Hello, everyone. So, as she mentioned, this presentation is called Navigating Medicare Together, the A, B, C's, and D's of Medicare. Basically, it's just going to be an overview of Medicare, the different parts of Medicare, the options, benefits, all of that. Okay, so this presentation is going to go over your benefits, Medicare eligibility, the enrollment periods, costs for Medicare in 2025, options for supplementing Medicare, and a little bit about Medicare fraud. I do want to go over what Center for Healthcare Rights is. So we are a nonprofit organization that provides free Medicare information, education, and counseling services to Los Angeles County residents. We are primarily funded by the California Department of Aging HICAP. That's Health Insurance Counseling and Advocacy Program. And HICAP is actually a statewide program, so every county has their own program, and we are the contractors for LA County and LA City. So if you call this 1-800 number here, that will bring you to your local office. Assuming you're from LA, you should be routed to the LA office. Otherwise, you'll get your local county office. And then here's our website as well, healthcarerights.org. And our number is also on the back of the Medicare and You book, if you have a Medicare and You book from California anyway. And so again, just a little bit more about HICAP and what we do. We are the HICAP is the California version of the State Health Insurance and Assistance Program, which is a nationwide program, which is here to help people understand Medicare, basically. Go over your Medicare options, benefits, try to help you with any issues you may have. And it is administered by the Administration for Community Living, which is part of Health and Human Services. And we are local, again, so every HICAP office is local to their community. So what do we do specifically? We provide one-on-one counseling and advocacy for Medicare beneficiaries, mostly over the phone, but we do a lot as well in person. We have various sites throughout the county, and most of our sites in person will be serviced by our volunteer counselors. We also do a lot of community education and outreach, like I'm doing right now. So we provide Medicare workshops and trainings for beneficiaries, caregivers, and social service and healthcare professionals. We do this in person and online. And we work with a lot of community-based organizations, senior centers, and other agencies in the communities. So what makes us unique? We are state-registered counselors with our own unique SHIP ID numbers. This means that we can call Medicare on a designated line, so we don't have to wait forever. They can provide us with more information about your benefits. We can get more information about your service denials if Medicare denies a claim. We can help file complaints with Medicare against your plan or maybe a provider if necessary. We can help enroll you in different Medicare plans if you need help with that. And we try to help with really just anything regarding Medicare. So if you have any issues with your Medicare and or Medi-Cal, we do try to help with those things. I do want to make it clear that we do not sell any type of insurance. We are required to be unbiased. Again, we're not here to sell anything. We're not here to tell you what to do, just help you basically understand Medicare or help you with any issues you may have with Medicare. Here are some common issues we help with. Of course, eligibility. So if you're new to Medicare or if you have questions about your eligibility, we can try to help you with that. We cannot confirm for sure if somebody's eligible. That is ultimately Social Security's job, but we can at least give you an idea if you should be eligible for Medicare. We can help you understand coordination of benefits. So if you have other insurance in addition to Medicare, like Medi-Cal or a retiree plan or something like that, we can try to help you understand how that works. We help with a lot of low-income programs like Extra Help and Medicare Savings Programs, Medi-Cal programs like the Working Disabled Program, or help you understand your share of cost, or see if there's a way to remove your Medi-Cal share of cost. We help people understand what balanced billing is, which is basically if you have Medicare and Medi-Cal, you can't be billed any co-pays for most services. We help a lot of people go over their plan options, so we can help you compare your drug plan options during open enrollment. Again, we help with appeals. We can try to guide you through the appeal process. We even have an attorney, depending on your issue, to see if she can actually help you with the appeal process. We do also help with Medicare secondary payer issues. We help with skilled nursing facility and hospital discharges. So if you feel like you're being discharged too soon, you can give us a call and we can provide you some guidance on that. And we do also have counselors who help with long-term care insurance. So if you have a long-term care insurance policy and you don't quite understand it, or you're getting notices about premium increases or benefit reductions, we can help you understand those changes. Okay, so what is Medicare? So Medicare is the federal health insurance program that provides health care insurance to people who are 65 and older, or people who are under 65 if you have a permanent disability, which means being on SSDI. Eligibility for Medicare is not based upon income or resources. So it does not matter how much money or resources you have, as long as you meet the basic requirements of being 65 and older or disabled and have a work history, then you can qualify for Medicare. Oh, and then of course you have to be either a US citizen or a legal permanent resident of at least 5 years. So here are the various parts of Medicare, A, B, C, and D. And this is just a brief explanation, but I'll go over them in more detail a little bit later. So Part A covers hospital services, home health care, skilled nursing care in a skilled nursing facility. So basically rehab in a skilled nursing facility after you've been hospitalized. And it also covers hospice care. Part B covers basically everything else besides your medications. So if it's outpatient, it basically should be covered by Part B. So that's doctor services, ambulance, labs, x-rays, diagnostic tests, durable medical equipment like wheelchairs and walkers. A lot of preventive care is covered under Part B, such as an annual wellness exam, vaccines, colonoscopies, mammograms. A lot of stuff like that is considered preventive and free of charge with Medicare. You don't even have to pay your deductible. Part B also covers outpatient therapy and, of course, mental health services. And then Part D is the prescription drugs. And then Part C is not really a separate part. It's more like a combination of A, B, and D. It's not mandatory, it's optional, but basically it's a managed care plan, also known as Medicare Advantage, and it combines your A, B, and D benefits all into one plan, usually an HMO. So again, who is eligible for Medicare? As I mentioned earlier, you have to be 65 and older and a US citizen or a legal permanent resident with at least 5 years of continuous residency in the United States. If you're under 65, you can also get Medicare as long as you have a permanent disability, meaning you are on Social Security disability for at least 24 months. You can also get Medicare under 65 if you have ALS, which is also known as Lou Gehrig's disease, or end-stage renal disease, kidney failure. So if you're on dialysis. For these two specific diseases, if you have it, you don't have to wait for the 2 years. You can basically get Medicare immediately after your diagnosis. These are the Medicare enrollment periods. Most people are going to sign up for Medicare during their initial enrollment period. So that's usually around their 65th birthday. So you have the month of your birthday, the 3 months before your birthday, and the 3 months after your birthday. So 7 months in total when you turn 65 to sign up for Medicare. During this time, as long as you sign up, there will be no penalty. And if you don't sign up at this point, there are other times to sign up as well. So if you don't sign up when you turn 65 or when you're first eligible because of disability, you can sign up if you have a special enrollment period at any time, as long as you qualify for it. So this would be normally for people who are still working and have insurance through their employer. Because as long as you're working and have insurance through your employer, you don't normally need to have Medicare. It depends on how large the employer is, and I'll go over that a little bit later. But A lot of people are working later now, so they're retiring later, and that is a concern for people. They think they need to get Medicare right away when they turn 65, and that's just not true. As long as you are working, or if your spouse is working and you have coverage through their employer, you don't normally need to get Medicare, and you can delay it until you're ready to retire. If for some reason you do not qualify for a special enrollment period, maybe you didn't want to sign up for Medicare because you didn't want to pay for it and you didn't have any other insurance, and now you're deciding, okay, I think I need insurance now. Unfortunately, you will have to wait until the general enrollment period, which is every year, January through March. And when you sign up, it starts the first of the following month. So if you sign up in January, it will start February. If you sign up in March, it'll start in April. But you just have those 3 months every year to sign up if you're signing up late and you do not have a special enrollment period. I do want to point out that if you are signing up during this period, you will likely have a penalty, because that means you did not have Medicare or other creditable health insurance when you signed up. So now you may have a penalty signing up. And that penalty, I should be going over a little bit later, but basically it's 10% of the Medicare premium, and it's 10% for every year you have not had Medicare but were eligible for it. And then this one here, the last one, the open enrollment period, is not quite the same as the others, but this one is if you already have Medicare. This is the one you see a lot advertised at the end of the year, open enrollment. So if you want to make changes to your Medicare, specifically your drug coverage, so if you want to change your drug plan, or if you want to switch Advantage plans or leave your Advantage plan to go to Regional Medicare, et cetera, this would be the time to do that. That's October 15th through December 7th. This is not the time to sign up for Medicare. Again, you cannot sign up for A and B during this time. This is the time to make changes if you already have Medicare. So this is information on the Part A premium. Most people are not going to pay for Medicare Part A, because as long as you have a work history of at least 10 years, then Part A should be free. However, if you do not have enough work credits, you can still purchase Medicare Part A if you need it, or if you want it rather. That's $518 a month if you have fewer than 30 quarters. So it is expensive to buy Medicare Part A. If you do have a work history, but you don't have quite 40, you have between 30 and 39, the premium does go down to $285 a month, but that is still quite a bit. If you don't qualify for free Part A, you may qualify for assistance to pay for it. So for instance, if you are on SSI, or if you're very low income, you may qualify for a program called QMB, Qualified Medicare Beneficiary, which is a program through the state that will pay for your Medicare Part A premium. Again, this is not something most people have to worry about, but if you are somebody who does not qualify for free Part A, I would definitely recommend giving us a call to see if we can figure out if there is a way for you to qualify to get Part A paid for by the state, or to see what your other options may be. Here are the costs for using Medicare Part A. So Medicare Part A does have a deductible for hospitalization. So if you're in there, it doesn't matter if you're in there 1 day or 60 days, you have a deductible of $1,676. After that, you have a copay of $419 per day for days 61 through 90. And then if you're in the hospital for longer than 90 days in a row, then you have 60 lifetime reserve days at $838 per day. Now that's a lot, and these are called lifetime reserve days because these are limited. So the first 90 days will reset after you've been discharged for at least 60 days, but these last 60 days, days 91 through 150, if you use those days, they're gone. So they don't come back. But the first 90 days will reset after you've been discharged for at least 60 days from the hospital or a skilled nursing facility. Speaking of skilled nursing, oh, yes.
Can I ask a question?
Oh, sure.
So let's say you have second hospitalization, you exhausted those 60 days,
Mm-hmm.
hit day 91,
Mm-hmm.
what happens?
You have to pay the full cost. Yeah, so that's not something that happens with most people, because in general, you would have a secondary insurance like a supplement, maybe you have Medi-Cal, And so in those cases, there's really no limit. I mean, technically, the Medigaps do have a 365-day limit, so the Medigaps do offer 365 more days, which, I mean, it's a year, that's a long time, but I mean, it is possible for somebody to use those as well. I've never seen that happen, but it can. And then the Advantage plans, this shouldn't be an issue with the Advantage plans because those basically offer unlimited hospital days. But with original Medicare, this could theoretically be an issue. It's just I've never really seen it happen because most people aren't hospitalized that long. And right, yeah. So again, after you've been discharged for 60 days from a hospital or skilled nursing facility, the benefit period restarts and you start over on day one. 60 days. You have to be out for 60 days of the hospital or skilled nursing. Mhm. Right. Right. Mhm. Oh, what were you saying? So you said how 60 days, right, at home, right, home health care, right, because you've been discharged and then you can go back to the hospital and then, yeah, exactly. So for skilled nursing, Medicare covers that as well under Part A. So if you've been hospitalized for at least 3 days and you need rehab, skilled nursing rehab, Medicare will pay for that, or at least part of it. They cover up to 100 days. The first 20 days are free, and then days 21 through 100 are $209.50 per day. Now, even though it says Medicare covers up to 100 days, you will rarely get the full 100 days. You really only get as many days as you need. So, if you're in rehab for 15 days and your medical team has decided, well, you've progressed enough or you've maintained a level well enough to go home, then Medicare will stop paying, okay? So at that point, you'll either have to leave or you can choose to stay, but you'll have to pay the full price. Now, Part B. So most people are paying the standard premium for Medicare, which is $185. As I mentioned, there is a late enrollment penalty if you sign up for Medicare late, and that is 10% of the current premium for every full 12-month period you have not had Medicare but were eligible for it, if you cannot prove that you had other insurance through an employer. So again, if you go 3 years without Medicare, that's a 30% penalty, and that is a lifelong penalty. So you'll be paying a 30% penalty for your Medicare Part B premium for the rest of your life, or at least for as long as you have Part B. If you ever cancel Part B in the future, you won't pay the premium, but you also won't pay the penalty, but that also means you won't have insurance. Medicare, the premium, even though I mentioned that Medicare is not based upon resources, meaning your eligibility is not affected by resources or your income, but your premium is affected by your income. So as I said, most people are just paying the base premium of $185 a month, but if your income is higher, you will pay more for Medicare. So that limit, that threshold is $106,000 for a single person, and for a married couple, $212,000. That's annual tax, yes, adjusted gross income. What, Lynn? So right here. So on the next slide here, these are the premiums based on income. So if your income is higher than the base limit here of $106,000 for a single person or $212,000 for a married couple filing jointly, then your premium for Medicare Part B will go up as well. And so here are the premiums on the far right, depending on your income. Again, most people are paying the $185, but it is possible to pay more for Medicare. And here's the cost sharing for Part B. So Part B does have a deductible of $257. So you'll pay the first $257 of your medical services, and then after that, it's basically an 80-20 split. So Medicare pays 80%, and then you get a bill for 20%, unless you have other insurance paying for that. But we're just assuming no other insurance, just regular A and B. Medicare, again, pays 80%, and you'll get a bill for 20%. There is such thing called the excess charges. It is not that common, but it is possible. Basically, excess charges are related to the Medicare approved rates. So for every service, every claim, Medicare has an approved rate, a negotiated rate. So it doesn't matter how much your doctor bills, Medicare will say, well, our approved rate is this amount. So I don't know, let's say the doctor bills $1,000 for a service, but Medicare says, well, our approved rate's only 100. So Medicare will pay 80% of that, you'll get a bill for 20%, and then if for some reason the doctor does not accept assignment, they can bill you an additional 15%, but only of the approved rate, which is $100. So they can bill you up to an additional $15. This is not something that happens often. If your providers accept Medicare, they usually do accept assignment. If you're worried, you should give them ask them. But in general, if a doctor says they accept Medicare, they will accept assignment. The only time you really see this excess charge is if you go to a provider who doesn't want to bill Medicare. Maybe they don't like billing insurance at all, but they'll still accept Medicare, but they won't bill them. So you have to bill Medicare yourself and then try to get reimbursed. And so you might have to pay more for it. Okay, Part D. So that's the drug coverage. So enrollment into Part D is voluntary. Okay, nobody needs to have Part D. Especially if you have other drug coverage. So if you have drug coverage through like a retiree plan or through an employer plan, really any kind of drug coverage is usually going to be as good, if not better than Medicare. So as long as you have that drug coverage, then you should not need Part D. And as long as you have that other drug coverage, you will not have a penalty for Medicare Part D if you sign up for Part D in the future late, right? So if for some reason, though, you never had drug coverage and then you sign up for Medicare drug coverage, you will have a penalty for every month you did not have Medicare drug coverage, yet were eligible for it. So if you go 12 months, so a year without Part D drug coverage, you'll have a 12% penalty. And that's based on the base premium, the national base premium for a drug plan. So this year, that's $36.78. So 1% of that is about 37 cents. So your penalty is about 37 cents per month for every month you have not had drug coverage if you sign up for a drug plan late. And that is also a lifelong penalty. So as long as you have Medicare drug coverage and you have that penalty, you'll be paying that penalty. Unless you ever qualify for some sort of low-income program like Medi-Cal or Extra Help, in which case the penalty goes away. So here are the two different ways of getting Medicare drug coverage, or just Medicare in general. You can have, on the left, just a prescription drug plan. So you'll have a standalone drug plan, and that works with your original Medicare. So with original Medicare and this prescription drug plan, you go to any doctor you want as long as they accept Medicare. Medicare, again, is your primary insurance. You pay the co-pays based on what we saw earlier. And then the drug plan premiums vary as well. So there's about, I think, 16 different drug plans in California. The lowest drug plan is about $1.80, and then the most expensive ones, I think, about $170, $180 a month. So there's a wide range of premiums. We do recommend you just do a comparison based on the medications you're currently taking. We get clients all the time who say, well, what if I'm prescribed this? What if I'm prescribed that? Honestly, it's difficult, impossible to pick a plan based on what ifs. So really just go off of what you're currently taking and then make changes in the future if you need to. And then on the right side, we have the Advantage plans, or how that works. So if you join a Medicare Advantage plan, you are assigning your Medicare benefits to this plan, essentially. So you're not going to use your Medicare card anymore. The plan you choose is going to send you a card, and that is the card you use for everything. So you go to the doctor, you get labs, x-rays, the pharmacy, whatever it is, that is the only card you're going to use because all services have to be billed to that plan. And then because it is a managed care plan, it is usually an HMO, so you'll have a primary care physician and they refer you to all of your specialists, and they all have to be in the same medical group usually. And then the premiums for these plans also vary, but for the most part, the Advantage plans are free. There's usually no monthly premium. There is a note on the bottom here. I just want people to be aware of, if you are paying more for Part B because your income is higher, that's known as IRMA, income-related monthly adjusted amount, you will also pay a higher premium for your Part D drug plan. Even if there's no premium for your drug plan, just the fact that you have the drug coverage through Medicare means you will have a penalty. I'm sorry, not a penalty, an IRMA, a higher premium. So for instance, if you join a Medicare Advantage plan that has drug coverage, but the plan itself is free, you're still going to have to pay the Part D IRMA because it includes drug coverage. So this is just a visualization of the two options. So on the left, original Medicare, so you use your Medicare card, and then you have a separate drug plan. And then on the right, the Advantage plan, so you have a card from that plan, and then it covers your A, B, and D benefits. Well, usually all A, B, and D. Some plans don't cover drug coverage. Those are pretty rare, but at the very least, they do combine your A and B coverage. So this just explains the difference between HMO and PPO. I feel most people are pretty comfortable with the definitions, but just in case, an HMO stands for Health Maintenance Organization. When you are in one of these plans, you must have a primary care physician. Your specialists need to be referred by your primary care physician, so it has to be authorized by your medical group. And then, again, all providers you're seeing generally have to be in that same group. So if you are with Optum, for instance, all of your doctors have to be at Optum. If you go to UCLA, all of your doctors have to be at UCLA. The only time you can leave this network is if you need emergency care or urgent care, or if somehow the plan approved you to see an out-of-network provider, which is pretty rare. PPO is just a preferred provider organization. This is not the same as having original Medicare, by the way. A lot of people think when they have original Medicare and a supplement, they have a PPO. That's not the same. A PPO is a very specific thing. It is a type of insurance plan that you have. You are still in a group in a sense, but you can leave the group. So you have a preferred network, and as long as you see doctors in that preferred network, you'll pay a lower copay. But if you want to see doctors outside of the network, you still can, but you'll likely have to pay a higher copay. You don't need a primary care physician in one of these plans. You don't need referrals usually to see specialists, and there's usually no authorization required for specialty services as well. But like I said, if you do leave the preferred network, you will generally have a higher copay for those services. So here are the Part D enrollment periods for prescription drug coverage. I kind of already went over the initial enrollment period. So when you are first eligible for Medicare at 65, or maybe if you get Medicare due to disability, most people are going to get your drug coverage at that point if you need it. If you don't get it at that point, then you can always get it during open enrollment, which is October 15th through December 7th. Again, that's to make changes to your drug coverage. And then we have a fairly new enrollment period called the Medicare Advantage open enrollment period. So this one is every year, January through March, and this is only for people who already have an Advantage plan. So if you have an Advantage plan on January 1st and you want to make changes to that, you have a 3-month period to do that. So you can change to another Advantage plan during this period, or you can leave the Advantage plan and go back to original Medicare. But again, this is only for people who already have an Advantage plan on January 1st. If you have original Medicare on January 1st, you cannot make any changes during this period. The only time you could make changes when you have original Medicare was during the open enrollment period, which is October 15th through December 7th. So the prescription drug coverage also has special enrollment periods. So if you qualify for certain special enrollment periods, then you can change your drug plan. So for most people, that would be if they lose other drug coverage. So if you have a retiree plan, and then, I don't know, maybe the retiree plan decides they're no longer going to offer coverage to the retirees, so you lose the coverage, then you'll have a special enrollment period to get a Medicare drug plan. or maybe you're moving. So if you have a drug plan and you move to a new county or a new state, whatever the case is, and that plan is not available there, you'll be told by the plan, and then you'll have a special enrollment period to get a new plan. And then a big one is if you are entering or leaving a skilled nursing home or a skilled nursing facility. So whenever you're institutionalized or living in a facility like that, you have a special enrollment period to change your drug coverage as well. And that could be either to a separate drug plan or an advantage plan, whatever you want to do. So here are the costs involved with Medicare drug coverage. Medicare drug coverage may have a deductible of up to $590, but it could be zero. But basically, if you do have a deductible, you're going to pay the deductible first. So you'll have to likely pay the full cost of your medications up to the deductible of $590 or whatever the deductible is for your plan. And then after that, you're in the initial coverage period, and then you just pay whatever your copays are for that medication based on the plan. So every plan will have different tiers for their medications, and so based on those tiers, your copays will change. So tier 1, usually preferred generic is the cheapest, all the way up to tier 6 specialty. So as you go to higher tiers, your copays will usually go up. But what is nice about Medicare drug coverage starting this year is that the coverage gap, or the donut hole, if you've heard of it that way, is now gone. It's just as soon as you hit $2,000 out of pocket, you hit catastrophic, and now you pay nothing for your medications for the rest of the year. Before this year, we had what's called the donut hole, or the coverage gap, where after a certain period, if your medications hit a certain number, you would have to pay a higher percentage of the cost until you hit catastrophic, and then even in catastrophic, you still have to pay for medication. So it's pretty terrible, to be honest. But now with this out-of-pocket limit in catastrophic, where you pay nothing, it's much more comparable to commercial plans that most people are familiar with. So here are some updates for Medicare Part D. I just went over one, the $2,000 annual cap on out-of-pocket prescriptions. Prescription cost, and this, as long as it's, what I should say is, as long as your medication is on the plan's formulary, then the $2,000 limit applies. If you're paying completely out of pocket for certain medications because it's not covered by the drug plan, those copays you're paying don't go towards this limit. So it has to be a medication approved by your drug plan. Again, there's no donut hole because now there's just a catastrophic once you hit a certain limit. And then here's another one called the Medicare Prescription Payment Plan. This just started this year. So basically, you can contact your drug plan and set up payment plans for the year to try to keep your costs the same throughout the year. So for instance, if you know you're going to hit catastrophic, your medications are very expensive, you're going to hit that $2,000 limit, you can contact the plan and they can split it up over the year instead of having to pay it in the first 2 or 3 months. All at once anyway. So this is about Extra Help. So this is a program through Social Security that subsidizes prescription drug costs. It will, if you qualify for this program, it can lower the premium for your drug plan, and it will lower the copays for your medications as well. Here are the limits, the income and asset limits to qualify for this program. So for a single person, the income limit is about $1,976 a month, with an asset limit of $17,600. If you're married, the income limit is $2,664. And if you have assets, the limit is $35,130. As far as the income goes, unfortunately, there are no deductions. That's a pretty hard limit there. So if you're even just a couple dollars over these limits, you're not going to qualify. For assets, they don't count the home you're living in and any cars that you own or life insurance, but all other properties or monies are counted towards that limit. But if you do end up qualifying for this program, your premium, depending on your plan, can go down to zero, or you can switch to a plan that has $0 premium, and then your copays will be automatically reduced as well. The most you'll pay for a generic medication is $4.90, and the most you'll pay for a brand name medication is $12.15. So these limits are, these copays are if you only have extra help. If you have Medi-Cal, you have a special form of extra help, which lowers it even more, and I'll go over that a little bit later. So there are gaps in Medicare coverage. So for instance, I already went over, the cost of Medicare, but there are things that Medicare does not cover. So Medicare doesn't cover any dental. There's no routine podiatry. They don't cover routine glasses. They will pay for eyeglasses after cataract surgery. So that's the only time Medicare will pay for glasses is after cataract surgery. Otherwise, there's no coverage. They'll never pay for hearing aids. They'll never pay for incontinence supplies. Well, no, they will if you are on hospice. Otherwise, or no, hospice or home health, possibly. But otherwise, no incontinence supplies. There's no transportation unless you maybe need dialysis. Otherwise, Medicare doesn't cover transportation. That's not in an ambulance. And then Medicare also does not cover any custodial care, like long-term care or caregiving, personal caregiving like IHSS. That would be covered by Medi-Cal. So here are the two ways of, again, getting Medicare. I went over original Medicare earlier. You have original Medicare, you have a separate drug plan. And then if you do have original Medicare, you can supplement it by having secondary insurance. So that will be usually a supplement or a Medigap, it's the same thing, interchangeable. Or maybe you have other insurance. Maybe you have Medi-Cal, or maybe you have a retiree plan through your former employer. So that's one way to supplement your Medicare. But if for some reason you cannot afford a Medigap, or you don't qualify for Medi-Cal, or you're not eligible for a retiree plan, then you really should look into an Advantage plan, just because having original Medicare on its own, just A and B, is a really bad idea. As I mentioned, Medicare Part B has a 20% coinsurance, and when you have Medicare and you don't have secondary insurance, there's no out-of-pocket limit. So you could theoretically be billed hundreds of thousands of dollars, okay? So I tend to tell clients that if you cannot afford a Medigap, or if you don't qualify for a Medigap or Medi-Cal, you really need to consider getting an Advantage plan, because nobody wants to be, seeing bills in the mail for hundreds of thousands of dollars because, you don't have other insurance to help pay for it. At least with an Advantage plan, the plan has an out-of-pocket limit. So no matter what, as long as you stay in network with your plan, you'll never pay more than the plan's limit. And a lot of them can be really reasonable, and some of the plans have a limit as low as $200. I mean, that's crazy. You pay $200 in copays in 1 year, and you pay nothing for the rest of the year, right? So that is something to keep in mind. Just please remember that if you are joining an Advantage plan, they are mostly HMOs, so you have to be aware of your medical group, where you want to go, and make sure that your medical team accepts your insurance. So I'm going to go over Medigaps now in more detail. So a Medigap is just a supplemental insurance. So it's a secondary insurance that you purchase that supplements Medicare. So it pays what's left over after Medicare. Maybe not all of it, but a lot of what's left over, these supplements or the Medigaps will cover. There are 10 plans, A through N. Each plan is a little different. So for instance, like Plan A covers only a couple things, and then Plan G is the most comprehensive plan. So if you have a Plan G, it covers basically everything except for the Part B deductible. But one thing you need to understand is that all of these plans are standardized. So every Plan G is the same, every Plan A is the same, every Plan K is the same. The only difference will be the price. So we do recommend that you call around, get some quotes, because there's no reason to buy a Plan G for $300 if you get it for $150 from someone else. It's the same exact plan. Some of these Medigaps do have a foreign travel benefit, so if you travel internationally, that is nice. I will say, though, that I would not count on that coverage completely, just because It's only good for 60 days. So if you're traveling longer than 60 days, they won't cover you. And they all have a lifetime limit of $50,000. So once the plan has paid $50,000, there's no more coverage. Again, that's a lifetime limit. So if you are traveling a lot, you might want to just get traveler's insurance. And one more special or important note is that all of these Medigaps are standardized and regulated by the California Department of Insurance. So when can you get a Medigap? So this is very important because most people only have one shot to get a Medigap. So that's when you first start Medicare. That can be when you turn 65, or it might be later. It's basically when you have both A and B at the same time, when those both start, then you have a 6-month open enrollment period to get any Medigap that you want. So at that point, if you contact a Medigap company, tell them you're new to Medicare, they cannot ask you any questions about your medical history, they cannot deny you, they have to sell it to you if you want it. That's because during this period, you have a guaranteed issue right, meaning that you cannot be denied. They cannot look at any pre-existing conditions. They can't ask you any questions. They basically just have to sell it to you if you want it. There is a possibility that your plan may have a 6-month waiting period if you do have a pre-existing condition. That doesn't generally happen. It really only happens for people who get a Medigap, but they didn't have insurance before getting the Medigap. So maybe they turned 65, but before they turned 65, or when before they started Medicare at 65, they did not have any health insurance at all. So when they started Medicare and got a Medigap, the plan may do a waiting period. It's not common, but it can happen, and it's only up to 6 months. After that, the plan still has to cover your pre-existing condition. And then there are other guaranteed issue periods based on federal and state rules. So depending on your situation, you may qualify for a guaranteed issue right to purchase a Medigap if you don't get it when you're first eligible. So for instance, maybe you have insurance through your employer or your former employer, it's a retiree plan, and then they decide that they're not going to offer coverage to retirees anymore. So if at that point you want a Medigap, you'll be able to get a Medigap because your employer coverage has terminated. Okay, Medi-Cal. So Medi-Cal is a very good resource for people if you qualify for it. It is the low-income program, Medi-Cal health insurance for California. It does have income limits, and at least until the end of the year, there are no asset limits. So for right now, the income limit for a single person is $1,801 a month, and for a married couple, that's $2,433 a month. These are not hard limits though, because the Medi-Cal does allow deductions from your income for certain things. So even if your income is over these limits, you still may qualify because you may have allowable deductions. So for instance, if you're paying for any health insurance premiums, that can be deducted from your income to qualify you for full Medi-Cal. The Medicaid or rules vary from state to state. So these are specifically for Medi-Cal in California, but other states have their own programs with different rules. These income guidelines change every year. And this note here on the bottom says that as of last year, the asset limit was eliminated, which was amazing. But unfortunately, due to budget cuts and stuff, starting January 1st, Medi-Cal will be reinstating the asset limit. Thankfully, it's not going back down to the $2,000 limit, but it's going back to the previous number of $130,000. So for a single person, your assets you can still qualify if you have assets under $130,000, and then if you're married, it's $195,000. So again, that's not starting until January 1st. So how do Medicare and Medi-Cal work together? So Medicare will be your primary insurance, and then Medi-Cal is a secondary insurance. As long as you have full Medi-Cal, that means without a share of cost, then the state of California will pay for your Part B premium. So it's like getting an extra $185 a month. because the state's paying that, so it's not being deducted from your check anymore. And then somebody who has both Medicare and Medi-Cal can never be billed for their Part A and Part B copayments or deductibles. So it is illegal to bill somebody who has both Medicare and Medi-Cal for Medicare-approved services. The only time you should be paying a copay would be for your medications. And even if you do have to pay for those, it should still be very low. It should be no more than $1.60 per generic or $4.80 per brand name. But otherwise, again, no copays unless it's for something that is not covered by Medicare or covered by Medi-Cal. Like glasses, for instance. Medi-Cal may help pay for glasses, but there's a limit. So if you go over that limit, you'll pay the difference. But for anything where Medicare was the primary payer, then it is illegal to be billed a copay if you have Medi-Cal. So how does Medicare work with your insurance through your work? Okay, so if you are 65 and older and have Medicare, then Medicare will be your primary insurance if the employer has, let me back up. If your employer has 20 or more employees, then your plan is primary and Medicare is secondary. So in this instance, most people are not going to get Medicare because when your employer plan is primary and Medicare is secondary, Medicare really doesn't pay for anything. So you're basically throwing away $185 a month. So in that case, you just delay Medicare until you retire, and then there's no penalty. If you are working but your employer employs fewer than 20 people, then you may need Medicare because in this case, Medicare is supposed to be primary and your employer plan is supposed to be secondary. So that is something you might need to speak with your employer about because they can choose to remain primary. If your employer plan chooses to remain primary at this point, even though they employ fewer than 20 people, you don't have to get Medicare. You can stay on your employer plan. But again, it is up to the employer. And if you have Medicare and you are retired and have a retiree plan, so maybe you're still working, but you have Medicare anyway, and then you have a retiree plan through a former employer, that is still considered retiree coverage. So in that case, Medicare would be your primary insurance and your retiree plan is your secondary insurance. So you would need to get Medicare in that case because Medicare is supposed to be primary. If you're younger than 65, so if you're on Medicare due to disability, the rules are a little different. So if you are working and have employer coverage, you can stay on that employer plan and delay Medicare as long as that employer employs 100 or more people. So it has to be considered a large group employer. So as long as they employ 100 or more people, you can stay on your employer plan and you can delay Medicare. But if they employ fewer than 100 people, then you will likely need to get Medicare because Medicare is supposed to be the primary insurance in that case. If you are working though and decide to delay Medicare, because like I said, it's kind of pointless to have Medicare if you're working and have insurance through your employer, then you will have a special enrollment period after you lose your health insurance through your employer or after you lose employment, whichever comes first. You'll have an 8-month special enrollment period to sign up for Medicare. There will be no penalty, and your Medicare can basically start right away. It's just, again, it's an 8-month period. You have to be very, very careful about this, especially if, let's say, you retire or you're laid off and your employer offers COBRA. If anybody mentions COBRA, I really recommend you give us a call because even though COBRA can be great, it can be really confusing and mess up your Medicare. So please, if you have COBRA, really think about it. Give us a call so we can walk you through the timeline of when you need to get Medicare because COBRA can really cause problems for people with Medicare. But again, as long as you qualify for that special enrollment period, you can sign up for Medicare without a penalty, and it basically starts right away. Okay, Medicare fraud. So I'm nearing the end. So we partner with Senior Medicare Patrol to provide education on fraud for Medicare and how to prevent fraud. So I just want to go over a few things about Medicare fraud. beware of telemarketers and door-to-door solicitors. Obviously they're very annoying, and it's illegal. They're not supposed to be calling you. They're not supposed to be going to your door unsolicited. So, try to ignore them or report them if you're able to get their information. Do not respond to any offers for free medical equipment or services. Those are usually too good to be true, especially if they're not coming from your doctor. So if some random person on the street is trying to tell you that Medicare is going to cover something for free, or if somebody's calling you to tell you this, hang up. It's very likely a scam. They're basically just trying to get your Medicare number so they can bill Medicare for services. In fact, I just had a client yesterday who was on the phone, or she was driving and somebody called her, caught her off guard. She thought they were Medicare, she gave them her Medicare number, and now she's worried that she's gonna be a victim of fraud. So again, if anybody's asking for your Medicare number, make sure you know who they are, because anybody who's asking for that, if they're not your doctor or your medical providers, there's a good chance they're just trying to get your number to scam Medicare. So there are scams year-round, but here are a couple of things to be aware of that insurance brokers and agents are not allowed to do. They're not allowed to conduct marketing or sales events at an educational event. They're not allowed to approach you in a common area, a public common area, or go to your door. If you're living at home, they're not allowed to go to your door without you inviting them. But like if you live in a senior facility and you have like a lobby or something, or a cafeteria, wherever it is, these agents are not allowed to approach you. You may approach them, but they're not allowed to approach you. Nobody can call you saying they're from Medicare, because they're not. Medicare's never gonna call you unless you call Medicare first. So if you call Medicare, file a grievance or a complaint, they'll call you back to discuss that, within 30 days usually, but otherwise, there's no reason Medicare's calling you. So if somebody's calling you saying they're from Medicare, they're not. Obviously, it should go without saying, but they cannot enroll you into a plan without your consent, but that still happens. They're not allowed to call you unsolicited. They can't send you emails. Again, can't make home visits without your consent, without your invitation. And obviously, they're not allowed to provide inaccurate or misleading information, but that still happens. So it is a good idea to always verify information that agents are giving you, either contacting the insurance company directly, maybe calling us so we can try to do some research with you. But and I don't want to say that all agents are bad, because most of them are good. It's just there are agents and brokers out there who are not always the most honest. So that's the end of my presentation. Thank you. And again, there's our phone number and our website if you have any questions. So, I don't know. Yeah, sure.
While she's looking at the question,
Yeah.
I saw a little asterisk about burial benefits. Can you speak to that?
Oh, so if you have like an insurance policy to help pay for a burial, part of that won't go towards that asset limit. That was the extra help, right?
Okay.
Yeah.
So it's not like any public insurance.
Right.
Yeah. And how? Yeah. That will cover it.
Right.
Okay. I had a list of like 5 questions, and then you answered each one.
Okay.
This was a phenomenal.
Sounds good. I'm happy to hear that.
There's none at the moment, but I did just send a chat, so we'll see in the next couple minutes.
Well, and again, our phone number is here, so if anybody has any, So if nobody has any questions now, this is our phone number, so please give us a call. You can speak with one of our registered counselors over the phone, or again, if you want to meet in person, we go to various sites throughout the county, so just let the person know when you're on the phone with them, and they can schedule that for you.
And your services are free, right?
Again, all of our services are free of charge. We don't charge for anything. Everything is free. Yes. And again, we're not selling anything, not trying to tell you what to do. We're just here to provide you with information and help. Thank you. Great. So I guess no more questions. Perfect. Do you know how many were on the 8? Okay.
Okay. Thank you guys all for joining. If you happen to come in a little bit late and want to rewatch the presentation, we will be sending out a YouTube link to our YouTube channel and you can rewatch this along with other education pieces. And just as a reminder, we do have another education piece later in the month, which is family dynamics and planning conversations. And then also we have our senior prom, September 18th. Thank you guys again, and look forward to seeing you guys in 2 weeks.